So looking at the act of physical examination in orthopedics. So physical examination usually follows what? Physical examination usually follows history taking. So after history taking, you have asked the patient some couple of questions, they have answered, and you have located the part of the body that has the problem. You know what? Physically examine the whole body, but paying attention to the part that what has the problem. Do you understand? So let's look at some things that you actually note during physical examination in orthopedics, because every branch of medicine actually has what you pay attention to. All right. So that the physical examination is actually what the process of evaluating objective anatomical findings. All right. Through the use of what you are observing, you are palpating, you are percussing, you are auscultating. Okay. So what inspection or observing, palpating you are feeling with your hands, percussing you are tapping to see if there's any abnormal sound, auscultating you are listening to what you are doing. All right. So let's proceed on this. So the information obtained may be thoughtfully what integrated with the patient history. So what you are trying to find out is related to what you actually heard the patient talk about. Do you understand? That's why I say you examine the whole of the body, but you pay attention to what the patient complains. The patient complain about pain in one part of the abdomen. You don't go start touching that place without being. Do you understand? So some disorders can be diagnosed at a glance. Okay. Okay. So for example, who would make mistake of the facial appearance of what acromegaly or the hand deformities that could be seen in rheumatoid arthritis? You can't make that mistakes. You understand? So nevertheless, even in these cases, systemic examination is still needed. So even if you know that is a problem of the patient, you must still examine them because you know some things might be hidden. You understand? So this systemic examination provides information about the patient's particular disability as distinct from the clinical pathological diagnosis, right? So it keeps reinforcing good habits and never to be forgotten, right? So it lets the patients know that he or she has been thoroughly attended to. You must do it. Okay. The examination actually begins from the moment we set our eyes on the patient, right? So you observe the general appearance of the patient. You ask them to lie down on the hospital bed or anywhere, right? So you observe their general appearance, you observe their posture and gait. You can spot if there's any distinctive feature like knock knees, spinal curvature, a short limb, if they have a paralyzed arm. That's general observation. We are at the level of observation now. Okay. You're also trying to see if the patient appear to be in pain, obvious pain. Okay. Then probably as the patient is walking towards you are observing, is the movement actually natural? Okay. Do they walk with a limp or do they use a stick? All right. A telltale gait may suggest a painful hip, an unstable knee, or a foot drop. You are basically looking at the gait, okay, of the patient. Okay, coming. All right. So as you are looking at the patient on general observation, you are trying to get some clues. All right. So the clues are endless, and the game is played by everyone at each new encounter throughout life. So in the clinical settings, the assessment needs to be more focused. All right. So when we proceed to the structural examination, the patient must be suitably what undressed. Okay. You put the hospital screen so that I can see everything. Okay. So no mere rolling up of the trouser is sufficient. They will pull out the trouser. Okay. So if one limb is affected, both limbs must be exposed. I've always tell you guys this thing. If you find out the abnormality on the left, you must compare it to the right. Okay. So that means we examine the good limb for comparison. Okay. then you observe the bad one. Okay, so there is a great temptation to rush in with both hands, a temptation that must be resisted. Okay, only by proceeding in a purposeful or orderly way can we avoid important signs. Okay, so you don't skip anything. Okay, so Alan Apley, who developed and taught the system used here, that's used in orthopedic, shied away using long words where short words would do as well. Okay, he also used to say, I'm neither an inspector nor a manipulator, and I am definitely not a palpator. I just Thus the traditional clinical routine includes inspection, palpations, manipulation, okay, was actually replaced by look, feel, and move. So this look, feel, and move, I'm going to discuss each one of them as applied to orthopedics, okay? So with time, his teaching has been extended, and we now add tests to include the special maneuvers we employ in accessing neurological integration, okay? And the complex functional attributes, okay? So that's it for the overview or introduction to patient physical examination in orthopedics. I'll be talking more on the concept that what involves physical examination as we go on.